Parents need to be present for their children, and if they're in pain or their diabetes is very flared up or they have a mental illness that is not treated, they're not going to be there for their children. I am Elaine Kennedy, and I am a pediatrician, and have been a pediatrician since 1974 when I graduated from medical school and went to residency. I worked for the Cherokee Nation in general pediatrics. We know that a parent's health is very important for their children's health. Adverse childhood events impact person's health when they are children, and it extends well into their later life. And a parent that has untreated medical conditions and is unhealthy is one of the 10 primary adverse childhood events that damages a child's health for their lifetime. If a child's mother doesn't have health care, she is going to be sick far more, and she's going to be unable to really see that her child is sick, and she may not be able to take care of her child when her child can't go to daycare or can't go to Head Start. So she is definitely going to be unable to take care of her child when the child needs her the most if she is sick. Parents need to be present for their children, and if they're in pain or their diabetes is very flared up or they have a mental illness that is not treated, they're not going to be there for their children. They're not going to be predictably compassionate and available to their child. If they're very sick and frightened about their own health, they can't do that. They're going to be emotionally neglectful. They're not going to be there for their child. When you're employed, most of the employers in rural Oklahoma certainly do not offer insurance for their people. They also very frequently do not have any paid sick leave, and they frequently will fire people if they're off. They'll fire people if they're off either taking care of their own illness or if they have to pick up a child at daycare who's sick and take that child to the doctor. They will lose their job because they're trying to get health care for their children. I think when a parent can't be at home with their children when their children are sick, and they're struggling to find just anybody that can stay home to take care of a sick child, that's very detrimental for the child, because the child needs their parent. They don't need just anybody taking care of them when they're sick. Mm-hmm. If children end up in foster care because they've been reported by the neighbors or they've been found to be neglectful parents, far more expensive for our state and very expensive and detrimental to the child's long-term health. Children in foster care are far less likely to graduate from high school. They are far less likely. Anything that keeps a family strong, keeps a family together, and keeps children in their own home with people that they're related to and out of foster care is terribly beneficial for the children for their entire life.